Next on the morning show, we welcome the co-founder of Total Knee Restoration Centers, Dr. Stephen Awwad. Good morning.
Thank you. Thank you for having me, and Happy New Year to both of you guys.
Yeah, Happy New Year.
Yeah, thank you.
It's going to be hard to follow the U of M guy, but we'll try our best.
Yeah, it's interesting. You know, this cold weather, right? Like, I think of like joint pains, and this weather, of course, is no good. But you know, we're talking a little bit about the knee today. Mm-hmm. It's interesting. I've never had knee problems, Bart. I know you've had some knee problems. You've had a hip replacement. Knee. Knees. It's like the most important, right?
It's
in the body,
pretty
right?
important joint. Yeah, mobility is key as we get older.
Yeah.
Most doctors will agree that the most important thing for us as we get older, for us to have a long, healthy life, is to move. And obviously, the knee is a crucial part of that. If you're having knee pain or knee discomfort, your mobility decreases, which affects a lot of other things. You know, your heart and your liver, your lungs, your brain, all really depend on movement. So if the knee, which is crucial in that movement pattern, is painful, most patients end up having less mobility and end up suffering with other health issues as well. So,
yeah, I think the Buffalo kicker had a knee problem yesterday.
Oh, yeah, he definitely needed some treatment. We hear bone on bone a lot.
Yeah.
What does that mean, Doc?
So bone on bone is a common term. Unfortunately, it's probably a little too common of a term used around most orthopedic offices. Essentially, bone on bone is when the meniscal tissue, which is the pads between the two knee bones, is diminished, and then the bones, the femur and the tibia, so this is your upper leg bone and lower leg bone, it starts to break down, and then the bones start to rub.
I'm gonna have you show me on that, Doc.
Yeah, sorry about that.
Oh, you're fine.
So this is called the meniscal tissue. So this is the upper leg bone called the femur. This is the lower leg bone called the tibia, and then this is the fibula. As the meniscal tissue starts to break down, the bones start to get closer and closer together until eventually these two bones touch, and they kind of grow together, and hence the term bone on bone.
Yeah, it's like fingernails on a chalkboard. It's just hearing that. It sounds really painful, and it can be incredibly debilitating.
Absolutely, and you know, the studies and the statistics on knee issues coming in the future are kind of stunning. We talked a little bit about that a second ago. So currently in our country, we perform about 800,000 knee replacements annually. By 2030, that number is supposed to increase to about 3.5 million. So that's an increase of over 330% in the next 6 years, which is a huge number. And we really don't have the surgeons to take on that load. And studies show that about 1/5 or 20% of those that undergo a knee replacement aren't happy with the results or disappointed with the results they get.
Are you, you're hearing a lot, surgery recommended, surgeries recommended. Is it always necessary? You've done some investigating, and you're able to help people.
That's right. And now, this is the difference between what we call true bone on bone. And you just brought the graphic up on that X-ray a second ago. A lot of patients are told bone on bone. So the graphic on the right here, it would show that there's complete loss of joint space on the inside, which is true bone on bone. Mm-hmm. The one on the left is diminished, but there's obviously still some gap there. And now, interesting enough, these are two separate patients, both diagnosed with bone on bone.
Okay.
So this term bone on bone is just being overused, and a lot of surgeons agree that it's being overused.
Sure.
And that becomes a problem. So with what we're trying to do with our office is we're trying to get those patients before it gets to the right-hand side, because once it gets to the right-hand side, it is true bone on bone. There's just not a lot of helping in those patients.
You brought a video that you can describe as we take a look at this. One of the, demonstrations of the knee here.
So this is what we call total knee restoration.
Okay.
Total knee restoration is achieved by using a proprietary protocol called the Knee Restore RX protocol. What it is a combination of therapies that's designed to distract the two bones, the bone above and below that meniscal tissue, and increase synovial fluid. Synovial fluid is like the lubricating joint fluid. Kind of think of an oil of an engine. So with arthritis, not only do we lose cartilage, but we also lose that ability for that synovial fluid to lubricate. So we say it's kind of like old engine oil. The oil may be present in the knee, but it's not really doing its job, which is lubricating the knee joint. So with the Knee Restore RX protocol and total knee restoration, we're bringing more synovial fluid as well as other healing factors back into the knee joint, pushing the old fluid out. So we kind of equate it to like an oil change for the knee. So this does a couple of different things. It increases that joint space. It helps that cartilage to regenerate or meniscal tissue to regenerate. And it relubricates that knee joint to make sure that the patients still doing well.
I'd rather get an oil change than change a part.
Well, you know, the thing is we say, why replace it if we can restore it?
Yeah.
You know, we're such a kind of a throwaway society now. If something's broken, we just throw it away and we get a new one.
Right.
And, you know, a lot of patients that are, you know, coming, so right now we have about 10,000 people turning 65 every day, which is astounding. A lot of those patients are in the old mentality, say, well, I don't want to throw it out if we can do something about it.
Yeah, so
now.
the increase in what you anticipate number of surgeries in the next few years, are our bodies just, what are we doing? Are we not taking care of our bodies? Or are we
So again, you know, that's the baby boomer generation next to the millennials is the second biggest generation. So there's just a lot of people turning 65, and as we get older, we start to naturally lose that space in between. So our bodies aren't designed to last forever. I mean, our skin changes, our hair changes, our bones change. But the reasons behind that high number, and we talked earlier about, you know, about 20% are disappointed.
Yeah, why is that?
So there's a couple of reasons. Number one is that patients' expectations are very high. So they think they're going to get a new knee, and that would be a normal knee, and that's just not the case. If you ask most patients before they have their knee replaced, they expect no pain and no restrictions on their mobility, and we don't. That's just not. So when you have high expectations, and then you still have the issue, you know, obviously you're going to be disappointed. Yeah. And then the second reason is that they're just getting done too soon. So like we showed you the graphic, you know, the patient on the right, yes, they're a candidate for a knee replacement. However, the patient on the left is not quite a candidate. And studies show that if you just have mild arthritis and you have your knee replaced, the outcomes aren't as good. Yeah. So not to say that knee replacements aren't effective, they are for the right patient, but unfortunately we're just doing way too many.
You need to do the right treatment with the right individual.
That's exactly right.
There's not a one-size-fits-all.
And when you have such a large patient base, you know, we had a patient in our office, she's not even 40 yet, and she was told that she had bone-on-bone in her knee, and, you know, she would have been, you know, really, really sad or disappointed if she had her knee replaced. Luckily, we were able to help her, you know, achieve the results that she was looking for and be able to maintain those results.
Non-surgical.
Right, and you've created this over your research over the years because of hearing of all these.
That's right.
These folks that were recommended for replacements.
Absolutely. So, you know, as a chiropractor, we were blessed to treat a lot of patients at my office in St. Joseph County. And over the past, you know, several years, mostly 5 years ago, we started hearing a lot of our older patients that were talking about knee pain, and we'd ask them what was going on, and they said, you know, I went to the doctor and I was diagnosed with bone-on-bone and I have to have a replacement. We didn't know anything about anything back then, so we just said, well, you know, that's horrible. We hope you do well. And we'd see that patient 6-8 months down the road and say, hey, how are you, Mrs. Jones? How'd your knee go? And they're like, well, you know, it's still kind of hurting. It's bothering me. You know, it's not moving the way it should. Some of them did really well, but there was a lot more than what I thought should have still had pain. And so we started doing some investigating, like most doctors should when something's not working. We were kind of looking for the reason behind it. And we started looking at their x-rays that were told they were bone-on-bone, and that just wasn't always necessarily the case. We actually had a patient, she went to 2 different surgeons. One said she had bone-on-bone, and the other said she didn't. And so it's tough when a patient is told, not knowing what to do, you know, when they hear 2 conflicting kind of things.
Right.
So.
All right, so people that are having knee issues, but you also have, your practice also includes the spine and discs. If people want to come in and talk to you about their issues, how do they do that?
So our clinic in Jackson, Total Knee Restoration Centers, you know, we take about 1 in 3 patients for total knee restoration. The reason is because some patients just have no space remaining and some patients have had a knee replacement. So we do a free consultation at our office at all times. So if you go call our office or go to kneerestorerx.com, that's our website. You can fill out some information to see if you're a candidate for this non-surgical approach to restoring your knee.
And you're right here in Jackson on Ganson Street.
On Ganson Street, that's right. Yeah.
Well, great to see you. Thanks for coming in today.
Thank you so much, guys. I really
Yeah,
appreciate
thank
the
you.
time
Great
today,
job.
very much.
Yeah, hopefully we have we're helping some people tuned in
for sure.
today.
That's the goal.
Doctor of chiropractics by trade with advanced training on extremities, especially knees, and founder of the Total Knee Restoration Centers, Dr. Stephen Awwad. More of the Morning Show after this.